Hello, my name is Dr. Carlo Renato. For those who don't know me, I'm a chiropractor based in Sydney, Australia, running a vestibular neuro-rehabilitation clinic which focuses on patients suffering from dizziness, concussion and whiplash-based conditions. I'm also a researcher undertaking a PhD in vestibular rehabilitation and finally an educator teaching these topics to practitioners across the world. It's with great pleasure and excitement that I announce a new series planned for 2018, Integrative Protocols for the Cervicogenic Patient, Vestibular Neuro-Orthopaedic Rehabilitation. Big title, and we'll get to some of those details shortly. Joining me in presenting would be Dr. Ulrik Sandstrom, based out of the UK, who's a recognised leading lecturer in functional muscle testing, taping, sports chiropractic, and is also a clinician to elite athletes at top level events. Together, Ulrik, the ortho guy, and myself, the neuro guy, will be showcasing the latest vestibular neuro-orthopaedic rehabilitation content over 2 days. My content will be focusing on the connection between the cervical spine, the vestibular system, eye movements, and spinal control, including balance, which will give you an understanding of the link between common symptoms, including dizziness, poor balance, neck pain and nausea, and poor eye movements. We're going to be discussing the overlap between whiplash and concussion from a neurovestibular position, so you can better identify how these patients may present in clinic. We're also going to discuss assessment and management of cervical joint dysfunction using low-tech and validated tools, giving you greater accuracy and confidence in your patient outcomes. Ulrik, the ortho guy, will be focusing on the musculoskeletal component to cervicogenic conditions, and obviously we'll be looking at shoulder and upper trunk components as well. He'll also be discussing imparting his understanding on what happens to the neck as a result of whiplash and concussion injuries, and Ulrik will be drawing on his vast experience in the sporting arena to relate how that can present. He'll also be discussing assessment and management strategies, including taping, functional muscle testing, and proprioceptive rehabilitation training to fast-track your patient's recovery. So come join us over 2 days as we've planned 15 hours of jam-packed with evidence-based content and hands-on practical workshops. Our goal is simple. We want to enhance your clinical competency in managing cervicogenic conditions from a vestibular neuro-orthopaedic approach, quite a unique way of looking at this, which can ultimately improve your patients' outcomes, those that are suffering from whiplash, concussion, cervicogenic dizziness, and neck pain. We're presenting in Oslo, June 16 and 17, and details can be found at www.brainhubacademia. We certainly look forward to seeing you there.